Hello guys, welcome back. We are here with another psychiatric topic, that is perinatal, postnatal mental health problems in women. So during the time of pregnancy or after pregnancy or before getting into the pregnancy or before planning pregnancy, some mental health issues will develop in some ladies, not in every ladies. In some women, some problems we will see, and that we will discuss in this video. As you all know that pregnancy and childbirth are exciting thing in our life, right? These two things are happy things in our life, but for some ladies these emotions can be complicated by thinking in different way. For some ladies these emotions can be complicated by thinking in different way. What will happen, how I'll manage the situation, what will happen to my body shape. So a lot of thinking process will or thought process will take place in their mind, and that can be lead to mental health issues. And based on the statistics and surveys by World Health Organization, worldwide about 10% of pregnant women and 13% of the women who have just given birth experience a mental health disorder. So it is a problem by World Health Organization. It is a notable problem. Okay, already it is noticed. So it is a problem. So we need proper treatment for this problem. Otherwise, chances of too much complications. And while coming to the problems, depression is the most noticed mental health problem. Depression is the most noticed mental health disorder in this pregnant ladies. And in developing countries, this is even higher. In developing countries, it is even higher, like 15.6% during pregnancy and 19.8% during or after the childbirth. And the statistics says that if we take 5 women, 1 woman is struggling with this problem. If we take 5, 1 person is struggling with this problem. So it means what? It is a problem which needs proper care and support. In which aspect of mental health we will see this problem means feeling of the lady, thoughts of the particular pregnant woman, actions, what they're doing, in their pregnancy experiences, in the economic and social circumstances which is there around them, family relationship, lifestyle habits, and or lifestyle choices, gender and sexuality, and their past experience. All these aspects we will see the problem. So we cannot specifically say in these aspects of their mental health they have problems, okay, which is there around them, which is there around their situations in society, okay. So in any of this area you can see problems. And what are all the common mental health issues means generalized anxiety disorder or GAD, generalized anxiety disorder, depression, psychosis, bipolar disorder, personality disorder, attention deficit and hyperactivity disorder, suicide and self-harm. So these are all the common mental health issues which we can see in pregnant ladies, okay. So sometimes this will see before pregnancy, I mean getting pregnancy or planning about pregnancy, thinking about pregnancy, or during the time of pregnancy, that means in that perinatal period, and antenatal after the thing, and postpartum, like after the delivery. So generalized anxiety disorder, depression, psychosis, bipolar disorder, personality disorder, attention deficit and hyperactivity disorder, suicide and self-harm. So here if you read at the end, at last have written suicide and self-harm. So the severity of the condition is literally high. If you're not treating in the proper way, chances of even suicide and self-harm also. So while coming to the problem, first thing is anxiety disorder, okay. So there are 3 type of anxiety disorder we can see, like antenatal anxiety, perinatal anxiety and postnatal anxiety. Antenatal anxiety, perinatal anxiety and postnatal anxiety. What is antenatal anxiety? Ante. So before getting pregnancy or for preparing for pregnancy, during that time you are getting some anxiety, like anticipation of what gonna happen to my life, what are all the things will happen, how I'll manage the situation, how I'll feed my baby, how I'll take care of my baby, how I'll manage my daily day-to-day activities, my job, my other things. So that can create an anxiety, and if it is beyond the level of control means that time it is called as antenatal anxiety disorder. Next is perinatal anxiety disorder. So perinatal means during the time of pregnancy, in that 9 months, okay, or 36 weeks, you are undergoing through lot of emotional imbalance, physical, psychological, social, spiritual changes, okay, and that can create some anxiety, okay, and that is known as perinatal anxiety disorder. Then postnatal anxiety. Post means what? After the pregnancy, or most probably during the first year after giving birth. There are chances of anxiety, okay, regarding the birth, regarding the child safety, their life development, milestone development, their growth, their feeding, and related to the lady's life, their bodies growth and changes in the height, weight, and shape, all the things, okay, that can create anxiety, that is known as postnatal anxiety. So these are all the three type of anxiety disorders we can see in pregnant women: antenatal anxiety, perinatal anxiety, and postnatal anxiety, okay. Next, what are all the signs we can see if the person is having anxiety? I mean, the pregnant lady is having anxiety, or the after delivery means they'll show stomach disturbances. They'll always complain about stomach disturbances, though they don't have stomach disturbances. Feeling lightheaded, or otherwise it's known as dizziness. Feeling restlessness, tensed, nervousness, headache, depersonalization and derealization, like they are not existing in this world, like that feeling will come, because they might be in the room for some days without doing anything, without mobilization, so that can create this derealization, depersonalization, and all. Then backache or other aches, faster breathing, sweating, insomnia, that means lack of sleep, nausea, needing the toilet more or less often, then changing in your sex drives and panic attack. Okay, like breathe problem will come, so panic at suddenly something gonna happen kind of feeling will come. So these are all the signs and symptoms of anxiety disorder during the time of pregnancy, or after pregnancy, or before getting into pregnancy. Then what is the treatment we can give? Means first and foremost thing is talk therapy. Talk, communicate with them, interact with them. If you are pregnant, talk to them, allow to explore your feeling, always open the window of your mind. If you have some problems, talk to them, talk to the person who is there, or whom you love, okay. So always talk, and if they cannot help, go to a therapist and get the guidance, counseling, support. And talk therapy is playing a major role in the treatment of this problem. Then cognitive behavioral therapy. Cognitive behavioral therapy will helps to change the maladaptive behavior into adaptive behavior. Then of course counseling, medication, that depends upon the situation and need of the lady. Then yoga, exercises, and always deviate the mind from tension, like don't focus on the point which trigger your tension. Then breathing exercise. These are all the simple techniques. If you follow, or the ladies are following these techniques, means definitely they can come out from the anxiety. A minor level of anxiety is common in everyone, because anxiety is not a disorder, it is a phenomenon, it is there in everyone's life. So if it going beyond our control, mean that can create lot of complications. So if you follow the simple techniques, and if you follow the therapist orders, means definitely you can come out from this anxiety. The next thing is depression. Depression is the most common perinatal, prenatal, antenatal problem. Depression means like feeling sad, feeling down, okay. You feel that you are not staying in this world, living in this world. And there are mainly two type of depression: perinatal depression and postpartum depression. What is perinatal? Same like perinatal anxiety, perinatal depression will occur during the time of pregnancy, that is known as perinatal depression. During the time of pregnancy, you are undergoing depression, like feeling sad, feeling low, feeling down, feeling tensed, feeling suicidality, means that is known as perinatal depression. Then postpartum depression, that means after the delivery, that is literally a complicated thing, and postpartum depression need proper treatment, otherwise the patient or the person or the lady will go to a severe level of mental health disorder. Okay, so these are all the two type of depression. And what are all the symptoms we can see? Means, as I told, feeling upset always, feeling sad, and feeling down always, and no self-confidence at all, hopelessness, restlessness, irritability, and indifferent to your partner. You feel something different while seeing your partner, and indifferent to your baby while seeing your baby, how you will manage, how you will take care. Okay, someday you will get angry on your baby. Then agitation, suicidal ideation. Of course, if you're not treating depression, if the depression is going to a severe level, means definitely that leads to suicide ideation. Then panic attacks and hard to sleep, etc., etc. Okay, and these are all the very limited symptoms I told you. These are all the common things, and depend upon the person, the symptoms will get varied. Then, while coming to the treatment, as I told, in anxiety, talk therapy, cognitive behavioral therapy, counseling, medication, yoga, exercise, deviate your mind from tension, breathing exercise. And in the case of severe depression, one more thing we will give as a treatment, that is ECT, electroconvulsive therapy. Electroconvulsive therapy. What is electroconvulsive therapy? Already we had a discussion regarding that in the previous videos. It is there. So what is electroconvulsive therapy? It means passing current into the brain. How much current you are passing means like 0.70 to 120 volt of current for 0.5 to 0.15 second. That much current you will pass to stop the abnormal discharge of electrical impulses from various parts of your brain, to make your brain to secrete normal impulses. But ECT is very dangerous thing. You need to do in the proper time, with proper guidance and proper consent from the necessary authority, because it is a complicated thing, because there are a lot of side effects for ECT, even death also. But if the patient is trying for suicide and self-harm, always means more definitely there is a need of ECT. That means electroconvulsive therapy. Next thing is eating disorder. Eating disorder is the most common antenatal, perinatal, postnatal problem. Okay, eating disorder means what? An unhealthy eating habit or unhealthy eating behavior, right? So there are three types of eating disorders are there: anorexia nervosa, bulimia nervosa, binge eating disorder, and other specified feeding or eating disorder. Already in the channel we have explanation about eating disorder. Go through that video, then you will understand what is eating disorder. Then eating disorder is depend upon the person. Okay, sometimes anorexia nervosa, like less eating, sometimes bulimia, like more eating, sometimes binge eating, like small portion many times will eat, and others unspecified eating disorder, like we cannot specify what symptoms they will show. So these are all the type of eating disorder, and any of this eating disorder you can see in pregnant ladies. And this eating disorder, if you're not treating, means that can lead to postnatal depression. Okay, so while coming to the symptoms, worrying about your body weight and body shape, always you will worry about your body shape. See, there are a lot of changes will happen in your body during the time of pregnancy, after the pregnancy. So eating disorder will make the person to worry about the body weight and body shape. Then avoid socializing, because socialization leads to eating and all those things, right? Because lot of opportunities will arise to eat, sit together, eat together. To avoid all those things, they will avoid socialization. Then not eating a lot, exercising too much, having very strict habit or routine around food. See, in which area or in which situation we need to eat more healthy and nutritious food. In that time you are creating a strict habit and routine around the food. Imagine, definitely complications will arise. And what are all the complications you can see means baby growth problems will arise, abortions or miscarriage, labor complications, premature birth, low birth weight. And this problem, if you're not treating properly, means the situation will get worsen, and postnatal depression leads to suicide, self-harm. Complications will continue and go on. Okay, so this is another problem. Next, prenatal, postnatal, antenatal, okay, mental health issue is obsessive compulsive disorder, followed by this depression. Only this OCD will develop, or along with depression most of the ladies are complaining about this OCD. OCD means what? You're repeating some activities to overcome the anxiety. You will repeat many activities many times, like washing your clothes, washing baby's clothes, baby's toys, baby's bottle. Like you feel that it is contaminated, so you you will give lot of time for these things. Then avoid changing even soiled nappies, because you feel that if you touch the baby will get contaminated. So you will keep on maintain, or you will keep on place the same nappy, and that create problems to the baby as well as you. Then keeping your baby away from your other people. Okay, you will not show your baby to others. And why? What's the reason? Like if the therapist asked you, means you will tell that baby will get contamination. Then constant checking on baby, though they are sleeping, also will make the baby to get up and check. Constant checking on baby and repeatedly asking to the people around them, like, how is the baby, how is the baby, you look baby is good, you look baby is happy, you look baby is clean, you look baby is neat. So a lot of questions will ask every time. So obsessive compulsive disorder along with depression only, always we will see this OCD. And what is the treatment? Means as usual, as like previous condition, talk therapy, CBT. CBT means cognitive behavioral therapy, to change the maladaptive behavior into adaptive behavior. Then exposure and response therapy. That means expose the person to the particular situation, like changing nappy. If they are not changing nappy, means force them to change the nappy, and show them whether anything happened to the baby. Like repeatedly expose the person to the particular situation and make them to habituate with the situation. Once they get habituated with the situation, they will give a proper response, like, yeah, there is nothing to worry, I need to change the nappy of my baby frequently, otherwise the baby will get infection, though that's what I should do that properly. So exposure and response therapy will help to change this negative behavior into positive behavior. Then medications and counselings depend upon the situation of the lady. Then postpartum psychosis. Postpartum psychosis is a rare but complicated mental health problem. It is a rare problem. Okay, it is not developing in many ladies, but in some ladies postpartum psychosis is developing. And what is the reason? Means we don't know what is the reason behind this condition. What is psychosis? Means disconnection from the reality. Okay, and it is also known as puerperal psychosis. And postpartum psychosis can create too much frightening experience, and it is characterized by excited, severely depressed, confused, disoriented and sudden mood changes, insomnia, unable to concentrate, delusions and hallucinations. They can see something which you cannot see. They can smell something which you cannot smell. They'll interpret this is, if they see something, they will tell this is this thing, and they will tell they have contact and connections with someone, like delusion of grandiosity, delusion of persecution, and always they'll show a fear, like someone going to kill them. Hallucinations and delusion. They will see something which you cannot see. So hallucination, delusions, insomnia, depression, confusion, always elated and excited situation. So that's what I told you, the symptoms can be frightening. So it can create frightening experiences, but it is a rare postnatal experience, a postnatal mental health condition. And what is the treatment we can give? Is as usual, talk therapy and other cognitive behavioral therapy, etc. And what is the cause of this condition? Means we don't know what is the cause behind this condition, but you can say the risk factors like family history of mental illness, traumatic birth during the time of baby delivery. If the lady is suffering a lot, means that can create this psychosis. Then family history of mental illness like schizophrenia, bipolar disorders are there in their family, means there are chances of this postpartum psychosis. And as I said, treatment include medications like antipsychotic drugs, because psychosis is there. So psychotic drugs, antidepressant drugs to overcome the depression. Then ECT, depend upon the situation, and support services. Okay. The next thing is postnatal PTSD, post-traumatic stress disorder. It is otherwise known as birth trauma. Okay, and it is also known as birth trauma. PTSD is otherwise known as birth trauma, and it is developed to traumatic birth and birth experiences during the time of delivery. The lady is suffering like anything, means that can definitely lead to postnatal PTSD, post-traumatic stress disorder. Okay, and sometimes the complicated birth experiences and unplanned cesarean section, emergency delivery can create birth trauma and postnatal PTSD. PTSD means post-traumatic stress disorder. And what are all the symptoms means flashback and nightmares. What is flashback means? The same incidents or the problem are happening again and again. They will tell, yeah, it's coming. They're gonna do the cesarean. Now my body is cutting. There is a session. Blood is coming. Like vivid flashback will come to them. Intrusive thoughts will come to their mind. Nightmares, intense distress. Okay. Then reminders of the trauma, like an alarm, that reminder will come to their brain. Then physical sensations always, like pain and sweating, pain in different part of the body, sweating. Okay, then easily they'll get upset and always they'll get angry. So these are all the symptoms of birth trauma or post-traumatic stress disorder. And while coming to the treatment, the same treatment only we are implementing for all the condition: talk therapy, cognitive behavior therapy, that is CBT, medications, counseling, psychological support, and avoid the triggering factors, because like a reminder the problem will come to their mind. So try to avoid that reminding situations, because that can trigger them, that can make the situation become more worse. So avoid the triggering factors. These are all the things. So these are all the antenatal, perinatal, postnatal mental health issues which commonly we can see. Okay, so as I said, based on the statistics, around if you take 5 members, 1 person is showing. But it is not a problem for every lady. Of course, pregnancy, of course, childbirth is an exciting thing in everyone's life. But for some person, some ladies, these problems will arise. But if you treat the thing in the proper way, definitely they can come back to the normal life and they can maintain all the regular day-to-day activities. Okay, guys, hope you understand. Thank you.